Was Ashley Zavala reporting. Let's bring in our panel now to get their reaction to this spending plan. We have KC24 political analyst and the host of podcast Unfiltered with Jim Verros. Jim Verros, thank you for being here.
Absolutely.
Next, he's gone from Fresno City Council member to current County Supervisor Steve Brandau. We appreciate you being here. And she's the CEO of Building Healthy Communities, Sandra Celedon. Welcome, everyone. We do want to make a quick disclaimer at this time that this is, at the time of this taping, the governor hasn't signed the budget yet, so we don't know. We're assuming he will. What do you think the odds are that Gavin Newsom will put his signature on this spending plan?
Well,
Steve?
He might be paying attention to us. Might veto.
He might hear what we have to say. You're right.
Might red X a few things. So, but very interesting that it got passed. I think everybody's been following it for a couple of weeks. There's a couple things in there.
There's some interest. There's some interest.
I don't know about $500,000 dog park. We build them in Fresno
in San
for
Diego.
About 60,000.
Yeah, this must be some dog park.
Must be some dog park.
We build parks in Fresno.
We build dog parks.
Okay.
Yeah.
Sandra, I'm sure you'd say we don't.
Not people parks.
I think if you ask most Fresnans, they'll probably disagree.
Yeah, that we need more.
Absolutely.
Jim, what do you think?
You know, this is Gavin Newsom's first budget, right? So he definitely wants to leave his sort of essence on this budget. This is no longer Jerry Brown's state. This is Gavin Newsom's state. So obviously he's going to stay the course on a lot of things that worked for Jerry. Jerry definitely worked on having rainy day funds.
Yeah, $20 million in this budget.
He definitely wanted to stay the course on that. But obviously there are going to be some certain things that Gavin wanted to get passed, and Governor Brown did not. And I think you have to take a look at the insurance issues that are affecting a lot of folks here in the state that Gavin Newsom feels that the budget needs to take a look at. So we'll see if it passes and how other organizations feel about the health insurance being available for everyone here in the state. So,
right.
That's a big thing for the governor.
It's a huge thing. Even actually the President of the United States had some comments about that, and I think we're going to listen to that right now.
You see what's happening in California, where they just announced a plan to give free health care to illegal immigrants, when it should very well be used, all of that money, to provide housing and hospitalization and medical for the rising number of homeless.
President Trump making those comments this week during a fundraiser in Iowa, and he says undocumented immigrants are not only threatening public safety, but also draining the Treasury, causing overcrowding in public schools and taking up resources which low-income Americans depend upon. Of course, this budget would provide health care to undocumented immigrants. I think all residents between the ages of 19 and 25, low-income residents, and also instituting the individual mandate where we all have to have insurance, and if we don't, we pay a fine for that. So what are your thoughts about this? The president not too pleased about that inclusion in the state budget. Sandra?
Well, I think, one, the president should be focused on issues across the nation, and we have a governor in California that is clearly reflecting the values.
Well, he seems to have an opinion on everything.
Well, unfortunately. And clearly, the governor of California reflects the values of Californians. The vast majority, in fact, 72% of Californians support extending health care to undocumented Californians. And I think, you know, the president is also incorrect. In fact, most undocumented people are not eligible for many programs that are available across our country and in our state. So extending access to health care for young people is really about investing in our future.
Is it on the backs, though, of others who choose not to have health coverage? Now they're paying a fine. Do you feel that people are being penalized in the state at the benefit of people who are undocumented? They're here illegally.
You know, I think it's going to be interesting, and if it does pass and they move to the next step, how the insurance is negotiated. And I'll be interested in seeing how the American Hospital Association, how the Nurses Association, how a lot of the other groups come out, because if the state of California is negotiating with the hospitals and the insurance agencies, then they may be able to get a better price than the hospitals directly. But if the American Hospital Association...
So that would be desirable.
I think so. I think that's where they need to start. If the state of California really wants to get involved with the insurance business, then they need to go head first, and they need to start really figuring out how to get these prices down. Having said that, I'm not sure the state of California should be in that business, but we'll see. If they think that they can just cut a check and then this is all, everyone's going to be covered, then you're going to see an inflated price for the kind of care that could be provided on a local level. There could be other ways, federally, I'm not sure, but in regards to this particular program, if the state of California does not become the insurance hub, you're going to see inflated prices from things from immunizations all the way up to long-term care.
So this is this an experiment then, Steve? What are your thoughts?
I actually agree with some of the sentiments of the president, not because he's a president, because I'm a Californian. I really see that California has dropped the ball taking care of our own people in the state of California. In the city of Fresno, we have rampant homelessness. The numbers are going up. We have difficulty with affordable housing. We're struggling with my former colleagues on Fresno City Council and my current colleagues at the county. And so to spend this much money on undocumented immigrants, I have some difficulty with that.
I know that the budget does, $2 billion will be dedicated to housing and addressing the homeless problems in the state. I don't know if that's enough, but it's a lot of money.
Well, it's certainly a really good start, and I think the other piece to this is the fact that undocumented Californians contribute about $3 billion annually to our state in forms of taxes. Not only do all Californians pay taxes, and many undocumented immigrants are not able to partake in our services and our programs. So I think this is a good first step. I think in terms of housing, you know, of course this is a great first step in addressing homelessness. I mean, locally we know that our numbers have increased, and quite frankly we're really not prepared. I mean, the city just went through its housing element. The county's barely picking it up for discussion. So if we're really serious about addressing local issues, we need to be prepared to draw down these state resources.
Yeah,
if history
and we need
serves us correct, we're not very good at that in this city and in this county.
Right, and that remains to be seen, how that $2 billion will be divvied up among, you know, the cities, and everyone has the homeless problem throughout the state, and so how that money will be divided will be
Stephanie, I believe that, you know, the governor's probably got great motives in doing this, and so do his supporters, so I don't want to bash them. But when the more stuff you offer for free, the more you subsidize something, the more you're going to get of that thing. So I already believe, you know, California already has about 40% of the nation's undocumented immigrants, okay? So, but I believe if we're going to offer them free health care, you're going to see our system swamped with you know, many more undocumented immigrants coming to the state of California.
That's an
when
incentive.
it's not provided in
you
other
feel
states.
That's an incentive.
Well,
and also we have to take a look at, and obviously we're looking at the nuts and bolts of this, but we also have to understand that it is now election season, and what got the president in the office is talking about stuff like this and taking a stand on it. And he loves bashing the state of California because where does it help him? It helps him in the Rust Belt swing states that got him in the office. He needs Gavin Newsom doing stuff like this because he needs an adversary, and he doesn't have one in his own party, and he doesn't seem to be very scared about anybody else who's running for office. He needs the state of California to be in that ring with him, and so he's going to continue to come after the state. If it's a budget, if it's whatever Gavin Newsom does, he's going to be talking about us for the next year because he needs that to raise money within his party.
Well, the other piece to this is that California, we need to focus on doing what's right for Californians. And the fact of the matter is that when we invest $1 in prevention, such as front-end healthcare services, it yields at least $3 in savings. So if we're really talking about making economic sense, this is again investing in our future by investing in young people. If we look at the fact that hospital associations supported the last Medi-Cal expansion in the original Obamacare program, we know that most people that are uninsured will end up in the emergency room system, where it costs at least 10 times more than treating people up front. So if we're talking about making just stretching our dollars, this is really a wise investment, and it's definitely not free. As I mentioned, folks are paying into that.
Yes.
If we understand how health realignment dollars work, folks pay into that, and that's how we're able to provide access to care to all Californians. And so I think this is a really good first step to ensuring our young people are healthy.
All right, we'll continue our discussion with our panel in just a few moments.